Hi, everybody, and welcome to today's Healthcare Provider Program on workplace safety and emotional health in a changing world. This is the first session in our two-part series, Caring Full Circle, Managing Your Needs as You Care for Your Patients. We're glad you could join us. My name is Stephanie Washburn, and I'm the Manager of Healthcare Provider Outreach at Living Beyond Breast Cancer, or LBBC. I'm pleased to serve as your moderator today. In case you're just getting to know us at LBBC, we're a national nonprofit organization that provides trusted information and a community of support to people affected by breast cancer. This program is part of LBBC's Young Women's Initiative, which provides resources created for people diagnosed with breast cancer before age 45. This initiative began in 2011 when we were awarded a cooperative agreement with the Centers for Disease Control and Prevention to expand our programming. We selected today's topic because of the challenge we know many people experience working in healthcare. Our speakers, Dr. Pamela Ginsberg and Lisa Capparella, will help us understand the impact of high-stress environments and strategies for managing emotional health. We thank Dr. Ginsberg and Lisa for sharing their time and insights with us today, and you'll learn more about them both shortly. We'd like to draw your attention to several LBBC resources we hope will be helpful to you. The second session in this webinar series for providers, New Perspectives and Practices in Palliative Care, will be held on Friday, September 27th at 2 o'clock Eastern Time. If you're not already registered, please join us. You can see the URL right there on the screen. We also have a 4-part Innovation in Care series for your patients starting on September 17th. Sessions will cover shared decision-making, innovations in treatment and side effect management, understanding testing, and financial and time toxicity. Patients can register at lbbc.org/innovations, and you are also welcome to join us. Please note that CEs are not available for that program. LBBC also has tips and information to help your patients manage their own emotional health at lbbc.org/emotional-health. You will receive links by email after the program so you can share this information with your patients and colleagues. Now let's move on to a few final details before the presentation. So today we're going to use the chat to connect during the program. I know that some of you have already started doing that. Thank you. And you will see the chat icon at the bottom of your screen. We'll also be using the Q&A feature. Please submit your questions for our presenters at any time. We ask that you frame your questions so they can be helpful to all participants. Our speakers will respond to as many questions as possible after their presentation. You can set up closed captioning by going to the button at the bottom of your screen. We'll be emailing you a link to the evaluation after the program. Your feedback is really important to us in planning future webinars, and we appreciate you taking the time to share your input. Now, just a few words about contact hours and CEs. This activity was approved by Montana Nurses Association, an accredited approver with distinction by the American Nurses Credentialing Centers Commission on Accreditation for 1 contact hour. It was also approved by the National Association of Social Workers for 1 CE. If you've registered to receive contact hours or CEs, you're required to participate in the entire live webinar today and complete the evaluation by September 26th. You will then be emailed your continuing ed certificate by October 24th. Certificates of participation will also be available upon request for providers from other disciplines. None of the planners or presenters for this educational activity have relevant financial relationships to disclose within eligible companies, except for the program's nurse planner, Lori Ronaldo, who has been a speaker for Myriad Genetics. All of the relevant financial relationships listed for this individual have been mitigated. We are recording the session and will post it on the program webpage later this month. We'll notify you via email when the recording is available. So it's now my pleasure to introduce our expert speakers. Dr. Pamela Ginsberg is a psychologist who specializes in working with women and health. Throughout her career, she has helped countless people make real changes to live happier, more fulfilling lives. Dr. Ginsberg helps people understand what blocked them from reaching their goals, teaches them how to make better decisions, set priorities, and create and implement action plans to achieve their goals. Dr. Ginsberg has a special interest in working with women with cancer at all stages, but also works with women facing any medical challenge. She provides support and guidance for medical decision-making and navigating the confusing world of serious illness. Her work in health psychology also includes working with family members who serve as caregivers for an ill loved one. Dr. Ginsberg also specializes in grief and bereavement, helping those who experienced a loss to understand confusing emotions and navigate the process of normal or complicated grief. She's also a member of LBBC's Medical Advisory Board. Dr. Ginsberg, we're happy to have you with us today. Also joining us is Lisa Capparella, who brings over 18 years of dedicated experience in oncology social work to her role as Associate Director of Patient and Community Engagement at NCI Comprehensive Designated Thomas Jefferson University Hospital. Passionate about improving patient outcomes, Lisa focuses on developing and evaluating innovative programs aimed at alleviating symptom burden and enhancing quality of life for cancer patients. Her expertise extends to integrative oncology, where she actively contributes to research and publications. Lisa champions patient-centered care by leading initiatives that prioritize patient input, including the Patient and Family Advisory Council. Recognized as the 2023 Oncology Social Worker of the Year, Lisa's commitment to excellent and compassionate care drives her ongoing contributions to the field. Welcome, Dr. Ginsberg and Lisa. Lisa, please join us on screen to share your presentation, and I'll now turn things over to you.
Good morning. Thank you so much for the warm welcome. It's been such a sincere pleasure to be invited by LBBC to do this talk with Dr. Ginsberg. We've had a lot of fun talking about our topic and what we're going to address today. If you give me 1 second, I'm going to share my screen. So just a couple of very quick objectives to go over in order to obtain our CEs. We're going to talk a little bit about navigating the impact of high-stress healthcare settings and really how that's come about during COVID and post-COVID. We're going to recognize and address compassion fatigue while nurturing compassion satisfaction. Dr. Ginsberg is going to lead us through some practical coping strategies that we can use while we're exploring grief and loss with patient care, and working with a variety of things individually with group techniques for maintaining emotional well-being while we're doing this very important work that we do every day. So I wanted to start a little bit with, what's happening in the last, let's say, 5 to 10 years in healthcare. There's been a lot of technology advancements. So 96% of hospitals have adopted electronic health records, which can be a good thing, and it can improve data accuracy and better patient coordination. But also there's a lot of things that come into play with patients who don't have the technology to be able to access that and divides that are being created. The Affordable Care Act gave more access to healthcare, so more patients are coming to the healthcare system. And then the aging population, of course, the boomers are continuing to get older. By 2030, 20% of the population will be over 65, showing a demand in elder care and specific programs related to those who are over the age of 65. And with that, we're also seeing an increase on pressure on healthcare providers. Many of us are seeing this, especially in oncology care, but the amount of patients who are being seen through survivorship and long-term care management, healthcare providers are reporting at least a 44% report of burnout. And interestingly, when we've talked about this, all of you who have turned on the news, those of you who are like me, who refuse to watch the news, are seeing a rise in workplace violence of over 47% increase in incidents. We're going to share a little bit more about that as well. But I pulled a bunch of these reports and resources, which we'll share at the end as well, that talked about critical topics such as the workplace violence, mental health struggles that are going on with healthcare workers, and impact of policy changes and new technologies being integrated. After my portion of our talk, Dr. Ginsberg will share practical strategies to help any of us prevent burnout, compassion fatigue, which is so very important to our mental health and well-being at this time. And so why is this so important? We've talked about this a little bit, but physical and mental health, right? The OSHA report is showing that there's at least a 34% increase in physical injuries that have been happening at workplace. This is also increased in healthcare providers specifically. 41% increase in mental health issues that are going on as well. And then sometimes when we're feeling burnt out and or stressed, there's more opportunity to prevent errors in patient charts or things that are happening that, wrong medications that might be given. There's a variety of issues that can happen in reference to errors that are happening. And so sometimes we do like to institute a little bit of humor. And of course, this slide can be, funny, but also for those of us that are in this type of world, we are seeing things like this. Workplace violence is an increasingly pressing issue, impacting a wide range of healthcare professionals. And while it's been increasing since COVID, it's really been something that, we're seeing. We're seeing people, nurses being stabbed, violence being talked about during the hospitals, patients being putting us in situations that we're not used to being put in. They're really rising. And then there's a lot of things that are underreported. So when I was looking at this, the rates of verbal abuse and physical violence, which had been reported pre-pandemic, were 44 to 66%, are now reporting to be close to 80%. Especially in oncology, those things are, patients are being faced with an advanced illness. They're scared, they're worried, they're anxious, and those types of things end up, really impacting the patient care and the way in which they're treating folks around them. And so this has an effect on all of us who are working in this. There could be physical effects that are happening if you're hurt during a trauma or a patient does physically attack a patient. There can be an increase in anxiety and depression, post-traumatic stress disorder, decrease in job satisfaction. So it's important to our healthcare providers who are providing us with jobs to pay attention to this. We already are seeing an influx of, social workers, nurses, physicians, people leaving the field due to the increased demands that we're facing in the world. It has an impact on patient care, as I talked about in the previous slide. If we're leaving and new staff is coming over, there's turnaround changes, there's opportunity for errors that are happening. And then as we leave, positions or places, there's economic consequences to this, of course, too, right? As we all know, it can cost a lot of money to hire and train new staff. And really, it's kind of very important to kind of keep our staff and keep them as safe as possible. And so which risk factors? Many of you probably already know many of these, but we might be working with people who are volatile, people who are using drugs or alcohol. We might be working in understaffed positions. We're seeing this a lot in hospital cares, inpatient and outpatient. We're seeing this as an opportunity for, patients to be waiting for a long time. There might be a delay that's not being communicated to patients, which can cause frustration and anxiety as well. Transporting patients to different locations or having them have their care in different areas of the hospital can also create issues. Inadequate security that we're seeing, and the hospitals can be open to the public in certain areas. So again, I want to get back to some of the statistics. As I was reading this, I started looking at, I really wanted to look at data post 2020 because it seems that things have really kind of increased during that time. And as you can see, on the left-hand side, the industries, you see the private industry is not impacted greatly by physical violence, but hospitals and nursing homes, residential care facilities, people working in social assistance offices are much more likely to report any kind of physical but non-fatal assault that's coming in, to the hospital and impacting our healthcare workers. And again, as you can read here on the side, it says a sad irony is every day that I head off to work, I worry that I might end up in a hospital as well. And again, just to sort of share a little bit more about what folks are experiencing. This was this particular study that was done in 2023, impacting nurses that have come across the board. And keep in mind that some of this is also underreported, but we might be seeing these things. We're seeing staff that might be physically assaulted, shot, firearm, scratching, biting, hitting, sexually assaulted and or harassed, objects being thrown at them, or other intimidation criteria that's been impacting staff members here by patients or at the bedside. So I just don't want to be a Debbie Downer, but I think the pressure that's been on us to overperform, to see more patients, to streamline everything has been really important. It can really impact our mental health and our well-being, which is why I think it's so important. We've been called to this field, many of us, because we have a passion for this. We want to work with patients. We want to work with folks and help them. That's kind of why we've entered this field. But some of us may also be feeling a level of compassion fatigue and or anxiety around our work and the amount of things that we need to come up with. So I just wanted to point out that the numbers are here to support why we might be feeling more stressed than we had been in the past. And to take a little bit of a spin, some of you may work in healthcare settings that had large responses to things during the pandemic and post-pandemic. And while some of these programs may have faltered or sort of fallen off the wayside, here at the Cindy Kimmel Cancer Center, we've really expanded care to be multi-centric. So things that could be offered individually to people in a variety of different programs. I'm going to share on my next slide as well, but we offered entirely integrated behavioral health program. So our staff could be seen by our psychiatry department here at the hospital. We had RISE, which was supported by our nurses and spiritual care department who were offering services. We had Jefferson Be Well programs, things like a yoga meditation program. We had group programs and individual programs. We adopted departments and other opportunities to help support one another. While many of these programs do still exist, what we found was a lot of the individual programs that people were looking for did start to fall by the wayside. The group programs fell by the wayside, and the individual support was what people were looking for. We created opportunities for an enhanced EAP program and an opportunity also for people to be able to do clinical therapy via virtual attendance that was outside of the EAP benefit, and also lower the copays and the rates for all the mental health services that our staff could access. This is much like Maslow's hierarchy for those of you who are familiar with this, but if you don't have the bottom met, it's very hard to meet the top higher level needs. But we ended up doing, self-help resources. So people could use EAP, they could look at recorded mindfulness type sessions. Then we did local units. So we might go to a local unit in the hospital and provide support or education there and find out what those specific needs were for that particular unit. Then we offered peer support. So one of us might provide one-on-one direct peer support. And then we ended up offering professional support, which was much more one-on-one related care, which is actually what's been, like I said, more sought after for our current staffing right now. We've offered things like short center rounds as well. For those of you who are maybe familiar with that, it's been something where there's usually cases or discussions that are brought up. We actually had a staff member who was shot by another staff member, and it was very hard for our staff to really kind of go through what that was like, what that felt like. There was survivor's guilt. There was a lot of, safety concerns. How might we keep ourselves safe? What would we do for gun control and other things of that nature in our hospital? So we, banded together to kind of figure out what resources we could do, and found that there were lots of other hospitals and organizations. If you want to share in the chat, maybe something that you liked or that worked well for your organization as well, you certainly can. But I saw the Cleveland Clinic were offering well-being rooms, Mayo Clinic, New York Presbyterian, Johns Hopkins, a variety of places kind of came together to create a really comprehensive level of support. This was an article here that we're showing on the slide from the New England Journal of Medicine that we had published in 2021, showing really the need of what our services were. The bottom graph is about our patients who were in the hospital, those who had passed, those who were on ventilators. And then the top graph is the access from staff as to who was attending programs. So at the height of our programs, for 1 month, we had over 1,400 people who were coming to programs or attending any kind of support they could get for well-being during that time. And it did sort of mimic for a while, as you can see, if anybody remembers very well for the pandemic, the surges that started happening in the spring, and then it kind of fell off for a little bit and started to truck back up probably in the fall when the flu and different variants started coming out from the COVID-19. And so I just want to take a chance. I know we can't unmute and share, but you're welcome to think about any of these or share your own experiences that you want to in reference to why does this all matter and how does this connect with Dr. Ginsberg part of the conversation? Well, we know that we're stressed. We know there's a lot of things that are going on. We know the demands are high for healthcare providers, but there's so much support that we can do for ourselves with individual techniques that we can learn to have refuel ourselves really for the reason as to why we go to work every day. And so I just wanted to share a quick question. A quick response. I'm going to answer actually employee well-being. For me, I was a poster child. I tried all the different little therapy services that the hospital had created. I had run Schwartz Center rounds at the time for the hospital. We created some pet therapy options and brought in some different dogs to provide relief and had them in different waiting rooms and just sent out announcements to everybody during that time. So one of my most favorite things to partake in is in order for us to have pet therapy mindfulness programs and to support our staff because they're our most valuable asset in taking care of all of our patients who really need us day in and day out. I'm going to invite Dr. Ginsberg on screen, and if she maybe wants to share one of hers and head into some things that we can do together and work together. But thank you.
Thank you, Lisa. I appreciate that. And thank you to all of you who are here today. And this is a great entryway into my portion of this, which is going to be about understanding compassion fatigue or empathy fatigue, and really talking about strategies. Lisa mentioned burnout a number of times, and also the word compassion fatigue and empathy fatigue, and it's hard to know what's what in that. Burnout really technically refers to kind of workplace structural stressors, such as the violence issues that Lisa has been talking about, volume issues, tech issues. So it's more about kind of the structure. Compassion fatigue, which is also known as empathy fatigue, is really about the emotional impact of the type of work that we all do, because we know that doing this kind of work, we are human beings, and this has an impact on us, and we have to recognize what the impact is. We have to recognize within ourselves when we are in a danger zone with how much of an impact this is having, and we have to have strategies for what to do about it. As Lisa was saying, what specifically to do about it for you individually. It's nice to have all of those resources available. It's wonderful, actually, that those resources are available, but you need to know for you what works personally. So let's talk about compassion fatigue and empathy fatigue, which is distress caused by helping others. We are in a profession where we are helping others. And so it is an emotionally heavy job. And so distress is part of the game. And so what we need to know is that this can lead to extreme states of tension and preoccupation with other people's suffering. And one of the reasons why we see that is that we over-identify with other people sometimes. Sometimes there's somebody who comes through that we know that person personally, or that person is in a similar or the same situation as we are. They have the kids the same age, or they are the same age, or they live in the same neighborhood, or your kids go to school together, or something like that. And so it's very easy to begin to over-identify with a patient, which can bring on more empathy than you have for, say, other patients. So the tension, the preoccupation with suffering certainly can happen, and that over-identifying brings us to that. The opposite end of that continuum is that we disconnect. So we can over feel or we can under feel. And so sometimes we find ourselves disconnecting emotionally in order to protect ourselves. We detach, we numb out. And so that's apathy, really, is the turning off of emotion, and over-identifying is the over responding side of that. So Lisa, if you would go to the next slide, please. It's not just uncomfortable when we are experiencing compassion fatigue. It has an impact on our work, and it has an impact on our effectiveness. All of these things, apathy, isolation, bottled up emotion, all of these things can lead to poor judgment on our part. And poor judgment and emotional fatigue leads to errors. And so it is really important that you recognize that compassion fatigue is not just something that's uncomfortable for you, where you feel tired and wiped out and burnt out. It is really important that you recognize that it's dangerous. Which is why you have a responsibility to be able to recognize what your particular symptoms of this are, because these symptoms can bleed into your personal life, and they certainly can affect your professionalism. There is also this bottom little box here. It says progressive loss of idealism, energy, and sense of purpose. And that progressive loss leads to a worsening and worsening of the impact of compassion fatigue. And once we're kind of on that train, it's hard to jump off. And many of us have experienced this, sometimes just temporarily, where we're just kind of getting progressively more and more drained. And that's why the strategies are really important. We need to be able to recognize this as early as possible so that we can actually do something about it. Next slide, please. Symptoms of compassion fatigue. So it's really important to know that this can develop slowly or it can develop suddenly. Most of the time, this develops slowly, where we're just kind of burning out slowly but surely because we're just tired. It's just getting to us. But sometimes we see this develop suddenly, and where we see it develop suddenly are some of the situations or instances that Lisa described, such as a violence incident. Or the pandemic was a great example of that, where people like just kind of suddenly were completely burnt out. Some incident happened in the pandemic where they saw something that was very difficult, or they experienced something that was very difficult. So a particular incident can bring it on as well. And what all of this leads to, and again, you can have both sides of this. You can have hypersensitivity and you can have a lack of sensitivity. And so I want you to know kind of which direction you go to, because again, you need to be able to recognize when this is happening. For me personally, I know I go to lack of sensitivity. I start to kind of lose my ability to have empathy. And that is always kind of the big red flag for me, is when I'm having trouble empathizing with my patient. What this leads to is dread, going to work, feeling that sense of dread. Dread at work leads to guilt, which leads to more dread. And there's the train that we begin to, that begins to pull out of the station for us. And so when you're feeling dread and that guilt cycle, it's a warning sign for you that it's time to do something about it. Next slide, please. So these three key characteristics of compassion fatigue, if I could kind of boil this down, I really want you looking for these three things: physical and emotional exhaustion, cynicism, feeling very cynical about your work, and inefficiency. Those are the three that they're kind of the broad categories where if you are recognizing these characteristics, any one of these characteristics in yourself, it is time to employ some of the strategies that we're going to talk about in a few minutes. These three things lead to what I call moral distress. We go into working with cancer patients for a reason. We are trying to help. We are trying to ease suffering. We are trying to get good patient outcomes. We're trying to help people. And when we're feeling this way, it becomes very difficult to help people. And so we can no longer provide kind of our A+ care when we are drained, when we are feeling exhausted or cynical and being inefficient. And so we then have to deal with, additionally, a moral dilemma which is, I'm not doing a good job here. I'm not doing what I know how to do. I'm compromising my professional values and my personal values. When we have to act in a way that's inconsistent with our values, it is exhausting. It is even more exhausting. It adds to the exhaustion. So again, we're talking about that train and what happens when we're on that train. So what helps? I want to talk about strategies. In all of my talks, I always talk about strategies. I think they're really important. So these are the things that are protective for you. Compassion satisfaction, which I'll describe in a second, self-care, social support, and cognitive set. And I'm going to talk about all four of these things and why they are protective. And what I want to make very clear is that it is your responsibility to create your own personal tool belt. And so any combination of any of these things is going to be helpful for you. And I encourage you to let yourself experiment with all of these things, with any one or any number of these things, so that you can begin to understand what's actually helpful for you, because what's helpful for you is not necessarily what's going to be helpful for the next person. Next slide, please. So compassion satisfaction is not a term that most people are familiar with, but when we talk about compassion fatigue, compassion satisfaction is kind of the other end of that continuum. And compassion satisfaction really recognizes your ability to enjoy your work, to enjoy what you do, and to feel satisfied with what you do, and to find the meaning and purpose in what you do. We all entered into this profession for a reason. Not everybody chooses to do work that's so emotionally heavy, but you have chosen to do this emotionally heavy work, and most of us choose it because we want to make a difference. We want to feel that we're making a difference. We want to feel like we're easing somebody's suffering. And so compassion satisfaction is connecting deeply to the reason why you chose this work to begin with. And I really want you to actually spend some time thinking about this, and maybe even doing a little bit of journaling about this. I always think writing helps us to process information. I really want you to understand this on a very deep level. Dig in. What did you hope to get out of your profession before you started? What were your hopes about it? What meaning has it brought to your life? Specifically for you, what meaning has this work brought to your life? What purpose do you personally serve to your patients? You personally, not the person who works in the office next to you, but just you personally. How do you personally make a difference? What are your strengths in your work? How do you feel like you make a difference? And how do you personally ease suffering through your work? So that will help you build what's called compassion satisfaction, which helps to balance compassion fatigue. Next slide, please. So this is just a graphic of kind of that continuum, compassion satisfaction to compassion fatigue. Loss is unavoidable in our profession, right? And so we have to reach for compassion satisfaction in our work in order to manage the deeply emotional work of the losses. And so I want you connecting with the meaning in the losses, the sources of meaning in your work. Because if you only have losses and you have no meaning, then the losses take on such grave weight that there is nothing to balance that out. So what we need to know is that difficult life experiences are not meaningless. It is not meaningless when we have losses, but we can disconnect with the meaning when we're exhausted. We all know that death does not indicate failure. We know that people are going to die, and that is not a failure on anybody's part. But when we look for the wow moments, the moments of intense connection, the spiritual experiences, incredible coincidences, those help to balance out the heaviness of the losses. I know for me in my work, one of the areas of my work that gives me the most satisfaction is when I do end of life work. And people ask me all the time, how can you do this? But the truth is, I can't say I enjoy it. It's not exactly the right word, but I derive deep, deep satisfaction from doing end of life counseling with people and really helping people talk through their experiences, their fears, their worries, all of it, life review. Because not everybody can have those conversations. And so to be able to give people an opportunity to have those conversations, I think is very helpful, and I get so much satisfaction, and that helps to balance out the heaviness when that person does pass away. So I want you thinking about what you can derive. The other thing that's really important for you to know, because I think that a lot of people who work in hospital settings, especially after a patient passes away, you probably have none to very little contact with family members after a patient passes away. I can tell you that I have contact with family members in my role in a private practice. I have a lot of contact with family members after a patient passes away. And I will tell you that family members remember your kindnesses. They remember the nurse that was outstanding, the social worker who was exceptional, the person who went out of their way to show kindness and empathy and softness during this extremely difficult period for them. So don't you think for a second that you lose a patient and then nobody ever thinks about you again, because I promise you that your kindness and your empathy goes a very long way for patients' families long after they're gone. There's a proverb that says something like, if you help one person, you change the world. I'm a very big believer in that. So you have to understand the impact of your work. Next slide, please. Self-care. I always talk about this. I always have some version of this slide in almost every one of my presentations, whether I'm talking to patients or talking to healthcare workers. Self-care is not optional. I have to say that again because we see it as optional. Self-care is not optional. Self-care is mandatory. And if you are not spending the time understanding how to take care of yourself in a way that works, then you are not doing a good enough job. And you will never be able to manage a profession like this in the long term. And so you must invest in self-care. These 4 pillars of self-care is the most basic foundational self-care. And if you are not investing time in exercise, nutrition, sleep, and water intake, you cannot be okay. And so I want you to hear me very clearly about this because it's so basic, but we forget, we just don't think about these things. These 4 things are absolutely foundational. You cannot build a healthy house on a poor foundation. And you can't serve from an empty vessel. You have got to find ways to refill the well. So the 4 pillars of self-care, I absolutely want you thinking about. But these other things too, pursuing hobbies and interests, doing stuff that is outside of the world of cancer, that it really just is soulful for you, that makes you feel good, that makes you happy, that makes you feel satisfied, that has nothing to do with your skills in the workplace. Spiritual practices, obviously, that's very helpful for people. And so again, investing time in your spiritual practices can be very important. Investing time in your relationships, both within the workplace and outside of the workplace, in the relationship part of that, those experiences. Mindfulness practices, this is some people use mindfulness practices very regularly. Some people say, that's a little too crunchy granola for me. I'm not quite sure if I like that. If there's one thing in terms of mindfulness practices that I do want you to at least experiment with and investigate a little bit, it is breathing exercises. So if you don't know any breathing exercises, I want you to look up, just Google them. It's very easy to find. I want you to look up 2 breathing exercises. One of them is called squared breathing, and the other one is called 4-7-8 breathing. What these breathing exercises do is they activate your parasympathetic nervous system, which is the rest and relax part of your nervous system. So when you are in a stressful situation at work or at home or wherever you are, and you start to kind of feel that, you feel your blood pressure rising, you feel yourself going into a bit of a panic about whatever is going on, I want you to be able to have those breathing exercises ready in the tool belt to use anywhere, anytime. I want you practicing them at home, practice them before you go to bed, practice them when you're sitting at a red light. They are simple, but they are extremely effective at activating that parasympathetic nervous system. You must have tools. You must have tools. And the more concrete the tools are, the easier they are to grab in difficult times. Next slide, please. Cognitive set. This is about how we think about things. So it is important that we understand that we don't have a whole lot of control over our emotional lives. That's pretty automatic, but we do have control over our cognitive experiences, the way we think about things. And so we can choose to focus our attention this way or that way. The way you think about something has a very direct impact on how you feel. And let me give you a simple example of this. If I am walking down the street and I'm by myself and I see a man walking towards me and he's looking at me directly, I am going to either think he recognizes me, I know him, or he thinks I'm pretty, or some thoughts that make me not feel afraid, that make me feel good, actually. If I think that person is looking at me and intending to harm me, I am going to feel a very different way. So depending on my thought about the situation, my emotion follows. So the thought happens first, the emotion follows. And so we can choose how we think about things in a lot of different situations. And that means we can choose how we interpret our pain, how we interpret the difficulties that we encounter through our work. And I always want you, going back to that compassion satisfaction, I always want you looking for meaning, looking for the meaning in your work. There's a whole area of therapy called meaning-centered therapy that a lot of cancer centers are using with their patients, because we're looking for the meaning. We're looking for meaning in our most difficult experiences. I always want you looking for the value in your work. Next slide, please. And this is just another way of saying the same thing. So threat versus challenge appraisal. If we see a situation at work as a threat, we're going to have a certain set of emotional responses and cognitive responses. If we see that same situation as a challenge, we're going to have a different set of emotional responses and cognitive responses. So if I see a situation as being threatening, I'm going to react emotionally. I might feel very overwhelmed or anxious right away. Anxiety leads to paralysis, so I might get paralyzed and unable to think through the problem. The immediate thought might be, I can't do this, I'm going to fall apart. And then I start using coping strategies that don't work very well. If I see that same situation as a challenge rather than a threat, then I can mobilize my psychological resources. I can, okay, this is a situation that I'm not familiar with. What do I know about this? What can I do about this? I can begin to think through the problem. If I'm overwhelmed with emotion, it is very difficult to do this. So if I'm feeling challenged, I can then try new coping strategies. I can experiment with a new plan. I can ask for help. I can break the situation down into more manageable pieces. I can say to myself, where do I start? So I want you thinking to yourself in difficult situations, what can I learn from this situation? How can I grow in this situation? And what new skills must I develop to handle the situation more effectively in the future? And so again, this is just a way of kind of shifting cognitive set or your cognition about a situation. It's just another way to help yourself in these situations. And this is another area, I think, where journaling is actually very helpful. If you have a situation at work where you feel like you didn't respond very well because you felt threatened and you just kind of got overwhelmed with emotion, this is a great time to go home and spend some time with understanding that and seeing it differently and seeing what comes from beginning to think about that in a different way. Okay, that is the end of my slides. So I think we're going to go on to our Q&A at this point.
Yes, we are. So first of all, let me thank you both, Lisa and Dr. Ginsberg. You were amazing, and you might not have been able to see in the chat because you were presenting, but there were all sorts of comments about the value and the meaning that this conversation has already had on the people who are part of it. And there was a kind of robust discussion about self-care strategies and recommendations and tips that people were sharing kind of about their personal experiences and things that they're finding helpful. So I love that that has already been happening in this time that we have together. So thank you both so much. And thank you to our audience who've been really engaged. That is wonderful. So I wanted to, let's see, we've got about 15 minutes for questions, just under that. I wanted to start with a comment that came into the Q&A. I just want to read it because it's really significant what this person shares they have gone through and their colleagues. So just wanted to read it and see if either of you have any comments, and we'll move into some questions. So the person who submitted this said, I am so thankful for this education workshop. Last year, I worked at a hospital where 2 nurses and a medical student were stabbed. It became too stressful for me to work there because I was worried about my personal safety. I requested a transfer to another hospital and finally moved this past June. I'm feeling less stressed, no longer having sleep disturbances or GI issues. So just curious kind of what that brings up for you, Lisa, and your experience. and you, Dr. Ginsberg, as well, any comments or thoughts about this person's experience. And thank you to the person who shared that with us.
Absolutely. I mean, I think when we had the shooting that happened here at our hospital, I think it resonates with similar to what you had written in there. There was so much fear that went about. And so I want to commend you for recognizing that maybe being in that position or that place was just too hard for you. I liken it to, sometimes and I don't want to downplay this, but sometimes we have patients who want to come to a place that they're familiar with for their support groups. And other times patients go, it's too triggering for me. It's too anxiety provoking for me. I need to go somewhere else. So, choosing to pay attention to all those stressors that Dr. Ginsberg talked about earlier and saying, I think I need to change the scenery is really valuable. Protecting your peace and protecting your mental health is so very important. And some patients were like, I can't leave. This is where I am. This is what I did. And, when the shooting happened here, and others felt similarly to you, and they felt chastised for leaving, or they felt like they were in a difficult situation, but they did what they felt was best for them at the time. And I think that's what's most important.
Yeah, and if I can just add to that, we are merely human. That's all we are. We're just human beings like everybody else. And there's a bit of a myth of professional immunity that we should be able to rise above a situation like that. And if you can, fine. And if you can't, fine. I don't see that as a weakness at all. I think that it's our personal responsibility to take care of ourselves. And we do what we need to do to take care of ourselves. There is no such thing as copping out when it comes to your safety.
Great. Thank you so much for your comments on that. And again, to the person who was willing to share that very personal situation, thank you for doing that. I wanted to go back to a question that came in earlier related to something that you shared, Lisa, or I think you touched on it, which the question relates to kind of guiding students and people new to the profession in this very, very stressful time to enter healthcare. I mean, arguably it's always stressful, but with everything going on, and just wondering if either or both of you could comment a little bit more on either things that you've done or you've seen or what you'd recommend to our colleagues who are newer to the field or to students who are joining the field.
Yeah, and I'd love to hear what Dr. Ginsberg has to say about this too, but we onboard about 10 to 12 students throughout the whole entire hospital, not just the cancer center here that I oversee. We run a group supervision to allow people to work with others and learn what they're doing. But I think it's really important to help teach, new nurses and social workers, both what they're going to see, what's going to happen, and that their reaction to them is personal. Like Dr. Ginsberg said earlier, a way in which I react to something might be very different. When I first started taking students, I've been doing this for 18 to 20 years now. And so sometimes we forget how traumatic this might be, and that we're expecting more of people to do at home, right? Before, if you were on IV antibiotics, you were in a hospital or a rehab facility. Now you're home and the families are taking care of people. So we're seeing more sick people living longer. And I think being aware of that, with a student of mine who recently took a job here, she was feeling overwhelmed with the amount of loss that she was experiencing here. And we had to think about how might she talk about some of these wins Dr. Ginsberg talked about, because we focus on all the negatives. It's really hard. Someone coming new into the community who's never had a personal loss in their life or never had a personal loss that they've really worked with, a patient might be the first loss that they have. And how do they cope with that? And so we came up with the thing that they wrote a piece of note about the patient, like that brought them joy, and they put it in a jar. So they had somewhere to put it and they had somewhere to put their grief. But I think working with your students or new employees in a way that feels meaningful to them, we talked a lot about meaning and purpose. It's a huge portion of my work too, Dr. Ginsberg. Finding that out for our own staff, what makes them tick, what makes them happy, how do they like being rewarded, and how do we harp in on some of those positive notions as well.
Yeah, and I think that, what you're saying, Lisa, is so important because, again, we are willing to learn these things and give these things to our patients, and yet we're not very good at learning these things for ourselves or for our staff, and we have to see ourselves as being merely human, and that we can break when things get too difficult. And so the things that you learn to talk to your patients about apply to you too. And we have to humble ourselves a little bit to understand that, okay, I need this stuff too. And we have to value ourselves enough to invest in creating that tool belt that I talk about So that you are practicing on a regular basis. By the way, the tool belt is not the Band-Aid that happens after a problem. The tool belt is really about having practices that soothe your soul and create meaning and purpose for you throughout the course of your career and throughout the course of your life. It will serve you well to take care of yourself. And so that message needs to be normalized for our staff, for healthcare workers.
Great, thank you. Well, you are both doing an incredible job with normalizing it today. So I think that's huge, and we're already seeing responses from people about how much that matters. A question, I'm thinking somebody might have kind of referenced this in the chat, although I'm not sure, but it was something that also had crossed my mind. Lisa, at the hospital where you work, you had described a little bit earlier a number of services and programs that you were able, kind of collectively to put into place to provide additional support. And I'm wondering if you could talk a little bit more about kind of administrative level or system level, health system level support for those kinds of programs and resources for healthcare providers. And do you have any, tips or suggestions that people might be able to use if for some reason they have tried and their own health system hasn't been as receptive, or just if they're thinking about approaching administration about developing some additional resources for providers?
Absolutely. And I think, the pandemic was something that was really hard. It forced us to think quick and have a reaction. We didn't pre-plan. And now I think we're doing that post-pandemic and post things that are happening. We're starting to think, how do we protect the mental health of the people who we cherish the most, who work here, and, support our patients, because otherwise we don't have a good healthcare system. So I'm happy to talk to anybody offline. I'm happy to share my email and talk about how we created these things. But during the pandemic, it was much bigger than just one, we all came together as, it was psychiatry, it was our spiritual care department, it was social work, it was nurses, it was multifaceted care. But we found people who were willing to donate their time to do a 20-minute mindfulness that just popped on. And so those are easy little resources. We found that people wanted physical fitness programs, so we offered pop-up yoga type programs. One of the things that we didn't talk about here, but it kept striking me as you were talking, was the practice of gratitude. That's something that anybody can do. We could buy $10 journals. You could do it. You could get a prompt for free online and do it. But the more you practice gratitude, the more mindset that you can do that, Dr. Ginsberg was talking about. I struggle with doing mindfulness meditation, even though I've done the certification course. I find that being gracious and showing gratitude towards other people is what works for me a little bit more. So we ran 20-minute gratitude sessions where we would do a mindfulness session, or we would journal about those things together, and they don't cost anything. You could do it in person, you could do it, virtually. So there's a lot of opportunity that if someone here feels passionate about starting a monthly mindfulness session or something, happy to give ideas or tips for that. But it is fairly easy to do some of these things as long as someone has the interest and the desire to do them.
That's
I
great.
think
Thank you,
my
Lisa, so much.
mindfulness,
Oh,
I'm
please.
sorry, Stephanie. Just mindfulness practices does not always mean meditation,
Yep.
And so I think that people get very turned off because I don't want to sit in a lotus position for an hour and meditate. That's fine, I mean, mindfulness is many, many things. And I think that there are, to have practices that work for you, where you are being brought into the present, where you're understanding what your thoughts and emotions are doing to you, is very valuable.
Absolutely. Thank you both. Another question, and I do acknowledge absolutely the two of you have been spending so much time this entire time together talking about how we can take care of ourselves and the impact that that has on patient care. Wondering if any thoughts come to mind about what else we can do to kind of take care of one another as colleagues in healthcare. That question had come through. Does anything else come to mind? Just kind of looking out for one another.
I think it's very easy to be competitive at work. And I think that this is really a paradigm shift to be collaborative at work and cooperative with one another and supportive of one another, and to see our colleagues not as threats, but as sources of support for us, but we have to take risks in order to open ourselves up to people. And I know that that's not always easy to do. I think that, I know that there are men and women who go into this profession. And I think that, I work mostly with women, so it's easy for me to talk about this. I think that women have an unbelievable resource of sisterhood and kindness among ourselves when we choose that. And you know, I think that men have that as well. And when we introduce that as the norm, again, this is about creating norms, right? When we introduce that kindness, that support, as the norm, even just for myself, this is my norm. This is what I choose to, this is how I choose to interact with people. Then we are teaching people how to treat us, at least. So I think that it just has to be an awareness on your part about how you're going to interact with people.
Thank you.
Agree. And one quick comment from me, someone put in here that they have birthday cakes for the month. We do that too. Recent personal messages. So and I think that, like, let's just say you have an interaction that's abnormal for you and another coworker. Instead of getting defensive about it, be inquisitive about it, you know? Hey, like, is there something I could do to help support you? It sounds like, you know, we had a little bit of a tip earlier. So I think instead of like letting it boil or let a pot sit, you know, talking to staff that, hey, we've had a lot of loss on this unit. You know, when I worked at Fox Chase Cancer Center, we used to do a memorial session for patients, which was so important because Dr. Ginsberg talked about it. We've just faced loss so much all of the time. And if we don't have a place to put it, it builds up. So I think memorial sessions, celebrating each other's, you know, weddings, showers, babies, you know, things like that, being there when there's a death in their family. So like not just treating your coworker like a coworker, but getting to know them and trust them as a human. We spend so much time with them. And if you have crappy coworkers, I'm sorry, come talk to me. But like mentorship, right? Find mentorship. It's been so invaluable to me to, you know, when there's a tough situation or I'm being beat down by administration to make numbers or finances or something. I need somewhere to put that. I need someone to talk to and help support me. So, you know, utilizing those resources that you have that are also free. Mentorship is free. Most people want to mentor somebody else.
Those are awesome suggestions. Thank you so much to both of you and to everybody who is in our audience who is also sharing really, really incredible suggestions. I think what Sarah and I can do is take a look at the chat suggestions and try to figure out a way to cull that and share that as well after the program, not the moment after the program, but as we also are going to post additional resources on the program page, maybe we can add a list of these suggestions that people have provided to complement what you have both shared, Dr. Ginsberg and Lisa. So we are out of time for questions. Before we wrap up, I just wanted to ask, is there anything, Dr. Ginsberg or Lisa, you didn't have an opportunity to share that you would like to? It is okay if you didn't have anything else, but just wanted to open it up.
I think just thank you for this group being together, for chatting, for, you know, I think from what I'm seeing here, this was needed. So thank you, LBBC, for inviting us, for letting us have this discussion and really just sharing some of our passion points. So thank you.
Yeah, thank you both so much. It's kind of funny, we were thinking of doing a different topic for this program when we started planning in the spring, and just with everything, you know, that we're kind of seeing and hearing, we decided to change gears and go to this topic instead, which I think because of everything that you, Dr. Ginsberg and Lisa, have brought, feels like it's been very meaningful to the people who have joined. So thank you both so very much for sharing your expertise, your insights, your personal experiences. We are so grateful. And again, thank you to our audience for being so engaged in the discussion today. I'd like to again recognize the Centers for Disease Control and Prevention for their support of this program. As a reminder to our audience, you'll receive an evaluation link in just a few minutes. Please remember to complete it no later than September 26th. And for those of you who request contact hours or CEs or a certificate of participation, you'll be emailed your certificate by October 24th. And we're also, as you've already heard, going to send a link to you in the next week or so to a page on our website that has the slides, the recording, the transcript, and other resources related to this discussion. So again, thank you for joining us today and for the care that you provide to people affected by breast cancer. Take good care and enjoy the rest of your day.